Now for a health alert and a troubling new report about opioids in the Journal of the American Medical Association. The study found thousands of patients received a highly potent form of fentanyl when they shouldn't have. Researchers say the U.S. Food and Drug Administration and opioid manufacturers failed to closely monitor the use of the restricted fentanyl. Nearly 11.5 million Americans misused opioid pain relievers prescribed by a doctor last year, and opioids killed 43,000 of those users.
Now, that's according to the U.S. Department of Health and Human Services, which also points out health professionals are trying to find a way out of the ongoing crisis. Surgeons at the Cleveland Clinic in Weston are doing just that. CBS 4's Lauren Pastrana shows us what they're doing there to curb the crisis.
And I think I just served too many balls.
At 88 years old, Marvin Weiner is enjoying life pain-free. An attorney, he still practices law and plays golf. But after years of playing tennis, Marvin wore down his shoulder, needing replacement surgery.
I've been playing tennis for over a half a century.
He went to the Cleveland Clinic 3 years ago, and Marvin finally got his new shoulder.
I'm very happy I had such a successful result.
Still, Marvin had some post-op pain to get through, and his doctor's goal was to keep him from relying on opioids to treat the pain.
I did use one oxycodone along the way, and they gave me 30, and we threw 29 away.
I had one tendon that ripped away from the bone.
Susan Aramo Webster went through something similar nearly 3 months ago, and she also knew about the dangers of opioid addiction.
You're going to have bone taken off, and you're going to be, managing discomfort, and you prep yourself for that.
Despite exercising before surgery and believing in holistic healing, Susan still found herself needing something stronger.
And so what I did was I actually had an old oxy from an old surgery that was 4 years old.
Dr. Vani Sabe-san is an orthopedic surgeon at the Cleveland Clinic who performed Susan and Marvin's surgeries.
How is therapy going?
Wonderful.
Dr. Sabe-san says when planning for surgery with patients, she discusses the opioid crisis and the risks of relying on the highly addictive painkillers after the procedure. The National Institute of Drug Abuse says each day more than 115 people across the country die from an opioid overdose. That includes prescription pain relievers, heroin, and synthetic opioids like fentanyl. The Institute also points out 21 to 29% of patients prescribed opioid pain relievers for pain misuse them. And 80% of those who use heroin now actually started by misusing prescription opioids in the first place.
Although we know that the public is really getting better acquainted with these facts and the crisis, no one wants to be in pain.
Besides educating patients and giving them alternatives for healing, Cleveland Clinic surgeons like Dr. Sabe-san are proactive during the actual procedure.
We're doing research in them where they are bound to fat molecules and they slowly diffuse the anesthetic. So they locally, wherever that surgery is.
In the case of Marvin and Susan, Dr. Sabe-san numbed the nerves inside their shoulders, keeping them pain-free up to 3 days later. That's precisely when each patient took one opioid painkiller and from then on relied on over-the-counter meds instead.
2 weeks after surgery, when they asked me how high I could lift my shoulder, I was able to go like this.
I don't really like the feeling of the heavy drugs, and so I use more of a holistic approach.
Good. Hold it there, don't let me push that. Hold it there, good. Don't let me push it out. I think we just have to keep working on your strength, and I think you're going to get yourself 100%.
Lauren Pastrana, CBS 4 News.